In 2015, a nursing home in Gothenburg, Sweden cut its staff's workday from 8 hours to 6. Same pay, same job, 2 fewer hours on the clock. Management expected exhaustion to drop and nothing else. What actually happened surprised almost everyone involved. You've probably imagined what you'd do with 2 extra hours a day, sleep more, see your kids, finally read that book. But the real story of the Svartedalens experiment isn't about free time at all. It's about what happens inside your brain when you stop treating hours like the only thing that matters. For nearly a century, the world has measured work the same way. Time in equals value out. Sit longer, produce more. In 1930, the economist John Maynard Keynes predicted that within 100 years, people would work 15 hours a week and machines would handle the rest. He wasn't wrong about the machines, he was wrong about us. Here's the part almost nobody tells you. 68 nurses and assistants at Svartedalens took part in the trial. Sick days dropped by roughly 10%. Patients reported better care. Staff even organized more activities for residents, dancing, walks outside, things that hadn't happened in years. Somehow, doing less added up to more. Think about your own last workday. How many of those 8 hours were you actually working, not sitting at a desk, not staring at a screen, waiting for motivation to arrive, actually working? Stanford economist John Penkoville spent years studying something British munitions factories discovered by accident during World War I. When workers were pushed past 50 hours a week, total output didn't rise, it fell. Push someone past 60 hours, and their weekly output barely beat someone who worked 40. Fatigue wasn't just uncomfortable, it was expensive. A tired brain makes worse decisions, and worse decisions cost more than the extra hours ever earned back. That number matters later. The Svartedalens trial wasn't cheap. Gothenburg had to hire around 14 extra nurses to cover the lost hours, at a cost of roughly 12 million kroner over 2 years, close to $1.5 million. By 2017, the city council decided the price tag wasn't worth it and the program ended. On paper, it looks like a failure. But that's not even the strange part. The nurses who lived through it didn't remember it that way. Years later, many said those 2 years were the healthiest of their careers. Some psychologists point to something Daniel Kahneman spent decades researching, that people don't just react to how much energy they spend, they react to how depleted that spending leaves them feeling by the end of the day. A shorter, more focused shift left less residue behind. The exhaustion wasn't just physical, it was cognitive, and cognitive exhaustion is far harder to see coming than a sore back or tired eyes. You've probably felt this without naming it. The version of you at 9 in the morning is not the version answering emails at 4. Your patience thins, your judgment slips. You make a purchase you wouldn't have made 3 hours earlier just to feel a small win before the day ends. Here's the twist most coverage of the Swedish experiment missed entirely. It wasn't really about the hours at all. It was about attention. When a workday shrinks, people stop pretending to work and start actually working because there's no room left to coast. The nurses at Svartedalens weren't accomplishing the same tasks in less time by magic. They were accomplishing them because 6 hours of real focus can outproduce 8 hours diluted by fatigue, distraction, and slow mornings. Toyota tried something similar at a service center in Gothenburg back in 2002, also 6-hour days for mechanics. And profits there reportedly rose by around 25% over the following decade, with almost no increase in staffing costs. That wasn't a fluke. It was the same pattern showing up twice, more than a decade apart, in the same city. You've probably done this exact thing this week and didn't notice. Stretched a 2-hour task across an entire afternoon, simply because the afternoon was available to fill. Parkinson's law, first written down by historian Cyril Northcote Parkinson in 1955, says work expands to fill the time allotted for it. Economists have cited it for decades, but knowing it and feeling it are different things. When you have 8 hours, your brain unconsciously paces itself for 8 hours. Slower starts, longer breaks, a kind of built-in inefficiency that costs you without ever announcing itself. Consider a software company in New Zealand called Perpetual Guardian. In 2018, its founder tested a 4-day week with full 5-day pay for 240 employees. Stress levels dropped by nearly a third. Self-reported productivity held steady or climbed. The company made the change permanent the following year. Different country, different industry. same quiet lesson repeating itself. Compare that to your own inbox. A 2019 analysis by Rescue Time, a company that tracks how people actually spend their computer hours, found that the average office worker gets roughly 2 hours and 48 minutes of genuinely productive time out of an 8-hour day. The rest disappears into meetings that drift, tabs that multiply, and a kind of low-grade distraction nobody budgets for. The 8-hour day was never really 8 hours. It just felt that way, because the clock kept running whether you were using it or not. There's a warning sign buried in all of this. Actually, there were 3, and you've likely missed at least one of them in your own week. The meeting that could have been an email, the task you reopened 4 times instead of finishing once, and the hour you spent feeling busy without producing anything you'd actually remember by Friday. The Svartedalens experiment ended, but the question it raised didn't disappear with it. If shorter, more focused work can match or beat longer, diluted work, then the 8-hour day isn't really about output at all. It's a habit, inherited from a factory era that measured value by the clock because there was nothing easier to measure. Iceland ran its own trials soon after, between 2015 and 2019, testing shorter weeks across offices and public services covering more than 1% of its working population. The results echoed Gothenburg's almost exactly. Well-being rose. Output held steady or improved across the large majority of workplaces studied. Iceland eventually shifted a large share of its workforce toward shorter hours permanently, something that would have sounded impossible to Keynes's contemporaries back in 1930. None of this means fewer hours is automatically better. A shorter day only works if the freed-up time gets spent on real rest and real focus, not just spread thinner across the same distractions. Iceland's trials worked because unions and employers redesigned how the work itself got done, not just when it stopped. Cut the clock without changing the habits underneath it, and you just get the same fatigue on a shorter leash. So the next time your day feels endless, the problem may not be how much you have to do. It might be how much time you've been given to do it in, and how quietly that extra time invites you to waste it. Ronald Read, the Vermont janitor who quietly built an $8 million fortune through decades of unglamorous, disciplined saving, never worked fewer hours than anyone else on his shift. But he understood something the nurses in Gothenburg stumbled onto by accident: that the size of the effort matters less than what you do with the room you're given. Sweden cut the room in half. And for 2 years, in one quiet nursing home on the outskirts of Gothenburg, that turned out to be exactly enough.